بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is about knee effusion, how we can see the effusion on the lateral X-ray and how we can determine the amount of effusion in the lateral X-ray. Here, this is a lateral X-ray of the knee joint, and better to do the cross-table lateral. Why? Because it is also detect the lipohemoarthrosis in the knee. Here we see the fat bed sign. We depend on the fat bed separation sign. Normally, the fat in the suprapatellar pouch, the fat bed sign is less than 1 millimeter or about 1 millimeter, and if there is separation of the fat bed sign by fluid in the suprapatellar pouch, it is visualized on the lateral X-ray or cross-table lateral and indicate there is effusion, and we can determine the effusion visually according to how much it is separated. Here it is a normal X-ray with the suprapatellar fat bed. It is normal and it is about 1 millimeter. Here the same patient with the suprapatellar fat, it is not separated and it is not separated, and the MRI it is better than the plain film in detecting of the fluid and can detect as little as 1 millimeter in the joint. Here we see the suprapatellar pouch. It is separated as we see here. It is more than 1 millimeter and there is mild to moderate effusion noted on the suprapatellar pouch. Here the same patient with MRI and we see the effusion in the suprapatellar pouch. Here the separation of the fat bed sign and the suprapatellar pouch much separated, and here we have large amount of effusion. And here the same patient with large amount of effusion in the suprapatellar pouch. Here another patient with large amount of effusion in the suprapatellar pouch and associated with degenerative joint disease with patellofemoral osteophytosis. Here patient with large amount of joint effusion and filling the suprapatellar pouch. Here another patient with large amount of effusion, and we see here the separation of the fat in the suprapatellar pouch and indicate moderate to large amount of effusion, as we see here in this annotation, and here this is the X-ray, And as we see here, soft tissue density with separation of the fat bed sign in the suprapatellar pouch, indicating moderate to large amount of joint effusion. Thank you very much for listening. Hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.